and today we're going to talk about something that many men are curious about, but very few actually understand: how to naturally open your penile veins and improve circulation for stronger, healthier, and longer-lasting erections. Most men think erectile health is just about testosterone or libido, but the truth is, erections are primarily a vascular event. That means if your penile veins and arteries aren't functioning properly, no amount of supplements or pills are going to give you the results you want. In this video, I'm going to guide you through practical, science-backed ways to restore and maximize blood flow to your penis. By the end, you'll know exactly what to do to strengthen your vascular system, protect your sexual health, and regain confidence in your performance. And I can guarantee that at least one of the methods we cover today will be something you've never even heard about before. Let's start by breaking down how this actually works inside your body. Erections begin with blood flow. When you're aroused, nerve signals trigger the release of nitric oxide in the penile tissue. This chemical causes the smooth muscle cells in your penile arteries to relax. When those muscles relax, the arteries expand. That's called vasodilation. And blood rushes into the erectile tissue, filling the corpora cavernosa. At the same time, the veins that normally drain blood from the penis are compressed, trapping blood inside. This combination of increased inflow and reduced outflow is what creates a firm erection. If the arteries are narrowed, if the endothelial lining of your vessels is damaged, or if the veins are leaking blood too quickly, the result will be weak or short-lived erections. That's why we say penis health is a window into vascular health. So the question is, how do we open these penile veins and keep them healthy? The first method is exercise, and not just any exercise, but specifically cardiovascular training. Aerobic exercise such as brisk walking, jogging, cycling, or swimming has been shown to increase nitric oxide production, improve endothelial function, and lower arterial stiffness. A study published in the Journal of Sexual Medicine followed men with erectile dysfunction who engaged in 40 minutes of aerobic exercise 4 times a week. After 6 months, more than 40% of them reported significant improvements in erection quality. That's not magic, that's physiology. When your heart pumps stronger, when your arteries become more elastic, blood flows more efficiently everywhere, including to the penis. Now you might ask, what about strength training? Does lifting weights also open penile veins? The answer is yes, but in a different way. Resistance training boosts testosterone levels, which indirectly support erectile health, but it also improves insulin sensitivity, lowers visceral fat, and reduces inflammation, all of which are critical for healthy vessels. I recommend a balance: 3 sessions of moderate intensity cardio per week, plus 2 to 3 strength training sessions. Together, these will optimize circulation and hormone balance. The second method is pelvic floor training. You've probably heard of Kegel exercises, but most men underestimate how powerful they are. The pelvic floor muscles are like the support structure that helps trap blood inside the penis. Strong pelvic floor muscles prevent venous leakage, meaning they keep the veins closed while the penis is erect. A clinical trial conducted in the UK showed that men who performed pelvic floor exercises daily for 3 months experienced significant improvements in erection hardness and control over ejaculation. The protocol is simple. Contract the muscles you'd use to stop the flow of urine, hold for 5 seconds, then relax. Do this 10 times per set, 3 sets per day. Within 6 weeks, you'll notice greater rigidity and better control. And if you want to take things a step further, there is a 100% natural, scientifically proven solution that thousands of men are already using to restore powerful erections in just seconds a day. It's completely safe, easy to apply, and can be done at home. To learn more, or click the link I've pinned in the comments. This additional step, combined with the methods I've shared today, may be the exact solution you've been looking for. The third method involves nutrition. What you eat directly influences how open your veins remain. Diets high in saturated fats, processed sugars, and refined carbs contribute to atherosclerosis, the narrowing and stiffening of arteries. On the other hand, diets rich in antioxidants, nitrates, and healthy fats protect endothelial function and increase nitric oxide availability. Foods like spinach, arugula, and beets are loaded with nitrates, which convert into nitric oxide inside your body. Pomegranate juice has been shown in clinical studies to improve penile blood flow by reducing oxidative stress. Omega-3 fatty acids from fish like salmon and mackerel help maintain vessel elasticity. And let's not forget hydration. Even mild dehydration reduces plasma volume and makes it harder for blood to circulate effectively. If you want open veins, you need to eat and drink like someone who cares about their vascular system. The fourth method is avoiding vascular toxins. Smoking is one of the fastest ways to destroy penile circulation. Nicotine damages the endothelium, increases arterial stiffness, and reduces nitric oxide availability. Alcohol in excess also impairs nerve signaling and hormonal balance. Even recreational drugs like cocaine or amphetamines can cause severe vasoconstriction, limiting penile blood flow. If you want stronger erections, cutting out or drastically reducing these toxins is non-negotiable. The fifth method is targeted therapies. Medical science has developed several ways to rehabilitate penile circulation. Vacuum erection devices, also known as penile pumps, create negative pressure around the penis, pulling blood into the erectile tissue. When used properly, especially under medical supervision, they stimulate new vessel formation, improve oxygenation, and prevent tissue fibrosis. A review in European Urology found that men who combined vacuum therapy with daily low-dose tadalafil recovered erectile function more effectively after prostate surgery compared to those who only used medication. Another therapy is low-intensity shockwave therapy, which delivers acoustic waves to the penile tissue. This stimulates angiogenesis, the growth of new blood vessels, and improves long-term circulation. Clinical trials are showing promising results, especially for men with vascular erectile dysfunction. Have you ever heard of shockwave therapy for erections? Let me know in the comments below if this is something new to you or if you've tried it. I'd love to hear your experience, because many men don't even know this option exists. Another important factor is hormone balance. Testosterone plays a role in regulating nitric oxide synthase, the enzyme responsible for producing nitric oxide in penile tissue. Low testosterone doesn't just reduce libido, it also impairs vascular function. Men with testosterone deficiency often report weaker, less frequent erections. Regular blood tests can help you monitor your hormone levels. If your testosterone is low, lifestyle strategies like resistance training, stress reduction, adequate sleep, and maintaining a healthy weight can naturally restore balance. In some cases, medical therapy may be appropriate under supervision. Speaking of sleep, this is the sixth method for opening your penile veins: quality rest. During REM sleep, men experience multiple nocturnal erections. These nighttime workouts for the penis are nature's way of maintaining vascular health. Poor sleep, sleep apnea, or chronic insomnia disrupt this cycle, leading to weaker erections over time. A study in sleep health found that men who improved sleep duration and quality saw significant increases in testosterone levels and erectile function. So, don't underestimate the power of 7 to 8 hours of consistent, deep sleep. Stress management is also crucial. Chronic stress elevates cortisol, which causes blood vessels to constrict and reduces nitric oxide availability. Men under constant stress often develop performance anxiety, which further compounds vascular issues. Mindfulness practices, breathing exercises, yoga, or even a simple daily walk can lower cortisol and restore vascular tone. Remember, opening your penile veins isn't just about the physical body. Your mental state matters too. Now let's talk about supplements, because I know many of you are wondering if there's a pill or powder that can open veins. The evidence is mixed, but some compounds do show promise. L-arginine and L-citrulline are amino acids that serve as precursors to nitric oxide. Studies have shown they can modestly improve erection quality, especially when combined with lifestyle changes. Pycnogenol, an extract from French maritime pine bark, has also been studied for its ability to enhance endothelial function. However, be cautious. Not all supplements are safe or effective, and many are sold online without regulation. Always consult a professional before starting any supplement regimen. At this point, you may be asking, if opening penile veins is all about circulation, does that mean erectile dysfunction is really a warning sign of heart disease? The answer is yes, absolutely. Multiple studies have confirmed that erectile dysfunction often precedes cardiovascular events by several years. That means if you're experiencing weaker erections, it could be your body's early signal that your arteries are becoming compromised. This is why I always tell patients, don't ignore the signs. Taking action now, whether through diet, exercise, medical therapy, or lifestyle changes, can protect not just your erections, but your heart, brain, and entire vascular system. So let's summarize what we've covered so far. To open your penile veins and maximize blood flow, you need to 1. Exercise regularly, both cardio and strength. 2. Train your pelvic floor muscles. 3. Follow a vascular-friendly diet rich in nitrates, antioxidants, and healthy fats. 4. Avoid toxins like smoking and excess alcohol. 5. Use medical therapies like vacuum devices or shockwave therapy when appropriate. 6. Monitor and optimize your hormones. 7. Prioritize sleep and stress management. 8. Be smart about supplements. 9. Recognize erectile dysfunction as a cardiovascular warning sign. Practice these consistently, and I can promise you will see noticeable improvements in erection quality, stamina, and confidence within weeks to months.